Okay, so welcome to my webinar on diabetes, freedom from diabetes. I'm your host, I'm Ruben J. Guzman. MPH does not stand for the speed that I drive my car. That stands for Masters in Public Health. And I got that degree from UCLA back in 1988. And I'll tell you the rest of the story a little bit later, but I have a special story that I want to share with you as we begin this very, very important topic of diabetes. I mean, diabetes is another epidemic that we're seeing here in the United States. We're seeing tremendous numbers of diabetes cases. It's constantly on the rise. And we're seeing more and more younger people developing diabetes as well. So it used to be, I remember growing up, that diabetes was thought of as an age related condition, that people got old and then they got diabetes, and that's the way it was. But that's not the case today. So we're seeing more children, even younger children, by the time they're adolescents, developing diabetes, and we're seeing much more of that than we've ever seen before. Now, I wanted to share with you two particular stories. Now, one was my first introduction to diabetes. So what happened for me was it was 1980, I graduated from Cal Lutheran University, and I went to work in the hospital as I was preparing to study for my medical college admissions examination. And so then I worked in the hospital, and after a few months, I got promoted to become a pathologist assistant. Now, a pathologist assistant, I did several things. So I did autopsies. I also looked at every surgical specimen that came out of the operating room every single day. Everything, you name it. Everything that was excised from a human body had to be examined by the pathologist, and it had to be examined, and then we took samples for microscopic examination and preparation. I did all that preparation as well and sent that up to the pathologist. Every now and then I would get a call, and it was actually almost like every week. I would get, usually by almost on a weekly basis, I would get a call, and it was, Ruben, large specimen in the window. It was the operating room calling me. The operating nurse would say, large specimen in the window. Most of the time I knew what that meant. So I'd get my cart, and with my with a drape, just a white drape, and I would go up to the pathology window from the operating room. So there was a special window, and I would oftentimes find a large specimen. So it was fairly large, wrapped in a red infectious bag, and I would pick it up, and it was fairly heavy. And then I would put that on the cart and then wheel it back down to the pathology room for preparation. And I would leave it in the bag until it was time for the pathologist to come down and examine all the specimens from the operating room. Most of the time, that large specimen was an amputated leg from a diabetic. And I've never seen anything more horrific in my life. It's horrific. I mean, it's the black gangrenous leg that had a stench to high heaven because it was necrotic. It was basically dead tissue. Now, the doctor had to examine this to make sure that the amputation site still had good vascular flow. It had good blood flow in that area because they wanted to make sure that it was still healthy and alive in that section. But the rest of the leg was dead. It was horrible. It was horrible. And I had to prepare all this and deal with it. And it was one of the most gruesome things you could ever see. That was my first introduction to diabetes. And I got to see that quite frequently. Dr. Glover would talk to me about it because he was preparing me to go to medical school. And he would say, you know, this is completely preventable. It doesn't have to be this way. And he was very knowledgeable about nutrition, very knowledgeable about lifestyle. My second introduction to diabetes was when it was by 1995, early 1995. What happened was in 1990, in October 9th, 1990, I ruptured my Achilles tendon playing basketball. And the doctor told me I would never play basketball again, which devastated me. So I became a junk food vegan. Okay, so I was a vegan, but I was a junk food vegan. So I ate the Oreo cookies. I had the M&Ms. I had a whole bunch of other things, and I really wasn't even totally vegan. I was just vegetarian. So I had a lot of junk food, and I drank a lot of soda, and I did all the things that were really unhealthy. I was devastated. I was depressed. I didn't care. By early 1995, when I went to the nurse practitioner, she said, "Ruben, you've got issues. Your blood pressure is high. Your cholesterol is high. You're 55 pounds overweight, and your blood sugar is high." Not good. I got the message, but I didn't care until my friend walked up to me and said, "Getting a little chubby there, Ruben." Now I'm coaching my swimmers on deck, and I had a buttermilk donut in my hand. I wanted to throw it at him, but I didn't want to waste the donut. So I got real mad at him first, but then I got mad at me. And I realized I had caused it to myself. So that was my second introduction to diabetes, because I was at that point pre-diabetic. So what I want to share with you today is some very powerful information that can make a difference in your life. I am clear that it will make a profound difference for you. And it may be contrary to some of the information that you've heard before. Now, I can tell you this. In medical school, physicians learn almost nothing about nutrition. In fact, the practical knowledge of nutrition that they learn it's abysmal. It's just ridiculous. At UC Davis School of Medicine, we had a whopping 10 hours of nutrition in our nutrition course. We spent half the time studying kwashiorkor marasmus, beriberi, and scurvy. We haven't seen those diseases in the United States for over 100 years. The rest of the time, we studied the micronutrients, vitamins A, B, C, D, E, all of those, and all the minerals. That was it. That was the course on nutrition. Nothing related to lifestyle, nothing related to chronic disease. In fact, the book that they gave to us, by the way, most of the time we had to buy our own books, and they were very expensive. But for nutrition, guess what? They actually provided the textbook for us. Yes, I still have the book. I should have brought it out. But the book was provided to every medical student in every medical school in the entire United States by Upjohn Pharmaceuticals. Do you think there's a potential conflict of interest there? Just maybe. So if you think for a moment that your physician is knowledgeable about nutrition and what to tell you about how to actually eat in relationship to a chronic disease, think again. Unless they have taken years of independent study like I did to really understand and study the relationship of nutrition to chronic disease, they know nothing. They know nothing. Today, I actually teach physicians. I love teaching healthcare providers about the relationship between nutrition and lifestyle and chronic disease, and it really makes a difference. It's profound. So what I'm going to share with you today is cutting edge information, all evidence-based. All evidence-based, no weird stuff, no airy-fairy stuff. I have got no products, no scams, no gimmicks, none of that. Okay, none whatsoever. I do these for free, and here's why. One, I am passionately committed to eliminating chronic disease from the face of the planet. That's what I give my life to. I am passionate about that. Second, I believe in the power of paying it forward. I've got 4 boys myself, ages 34, 29, 22, and 20. I believe as adults, we all have a social responsibility to make the world a better place for our posterity. And that's what I'm committed to doing. So that's why I do these for free. And people think I'm crazy, but I'm crazy. Okay, I'd rather be crazy and be passionately living fully. So that's why I'm doing this. So let me get set up here and set us up for being able to go to my PowerPoint presentation. All right, if you have any questions, feel free to post them in the chat window at any time. And if you want to unmute yourself, you'd have to do that because you're all automatically muted. So let's see here. All right, let me set up. Take me just one moment. I've learned all the tricks of the trade now, so I can do this in the fewest number of clicks possible. All right, so now let's see here. Just about ready to go. And here we are. Okay, good deal. Okay, so freedom from diabetes. Now, as I said before, MPH does not stand for the speed that I drive my car. Now, what happened for me, just to let you know, when I got done with my master's in public health, I had a very important decision to make in 1988. So I had spent 3 years at medical school at UC Davis. My independent research into lifestyle medicine and chronic disease led me to the School of Public Health, finished my master's in 1988. And then I had the option to go back to medical school. At that point, I realized that I was passionate about promoting disease and promoting health and preventing disease, excuse me. And I was no longer committed to treating disease. So I made a bold decision at that point. I chose not to go back to medical school, and a lot of people disagreed with me, but that's okay. All right, so they did that, and so it's okay. So, and by the way, you don't need to record this because I'm going to record this, Ernie, and I'm going to send you the link to the YouTube video recording, so you don't need to worry about this. All right, all set up. I'll take good care of you. All right, so now, so I finished my master's, chose not to go back to medical school, and I started studying lifestyle medicine on my own. Now, back then, there was nothing called lifestyle medicine. I was ahead of my time. And so I studied from many brilliant people, including Dr. John McDougall, Dr. Caldwell Esselstyn, Dr. T. Colin Campbell, and Dr. Neil Barnard, and a whole host of others. And so the thing is, I did my own independent research. In 2016, I went to the International Nutrition Healthcare Conference. And at that conference, they announced, they had a presentation from the American College of Lifestyle Medicine. I was totally shocked. I was so surprised pleasantly. And I went to figure out everything, went to the website, everything else. I was delighted, thrilled, ecstatic. It was amazing. So I signed up to become a member of the American College of Lifestyle Medicine, an evidence-based approach to prevent, reverse, and treat chronic disease. Holy guacamole. I was so happy. And then I went to my first lifestyle medicine conference a year later in October of 2017 in Tucson, Arizona. And when I walked in, I thought I was in heaven. It was amazing because here I was with about 1,200 healthcare professionals, physicians, nurses, PhDs, the whole bit, brilliant people from 38 different countries. I was ecstatic with this. It was amazing. The vibration was incredible. And they announced at that conference the opening of a board certification examination for physicians, for MDs and DOs, but also for professionals. So that was for PhDs and those with a master's in a health-related field. That's me. So I was so excited. I had to sign up. I did, and I studied for a year. In October 2018 in Indianapolis, I went to my second healthcare conference on lifestyle medicine and passed my board exam, and I'm so excited. I couldn't be more proud. It has just been an extraordinary experience. So I am board certified as a lifestyle medicine professional. Lifestyle medicine is, again, it's an evidence-based approach to prevent, reverse, and treat chronic disease using lifestyle measures as opposed to medications. And guess what? We show in the research, we actually do a better job All right, it's more effective than taking meds. So the areas that we focus on, here are some of the areas that we focus on: nutrition, physical activity, emotional well-being and stress management, alcohol and tobacco reduction, healthy relationships, hydration, and sleep. Now, I do seminars on all of these topics, but I'm going to incorporate some of these in today's presentation and how it relates to diabetes. So real important to understand that. But this is a powerful, powerful process. It really is quite amazing. So again, I am board certified as a lifestyle medicine professional, and that is trained to empower you to prevent, reverse, and treat chronic disease. The day is coming, we're working on it right now. The day is coming where you could have two options when you go to a physician. You can either take the medications and just manage your chronic disease and have a shorter lifespan and have complications, or you can get referred to a lifestyle medicine physician or professional like me, and then you can actually have your care reimbursed by insurance and you can reverse your disease. So the day is coming where that's going to be covered by insurance. It's starting to happen. Medicare already covers the Ornish program, and that, which is a lifestyle medicine program right now, and we're expanding on this, so it's going to happen fairly soon. I'm really excited about this. So I get to live into this quote that Thomas Edison said well over 100 years ago, that the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. Well over 100 years ago, this is what lifestyle medicine is all about. Again, just to let you know, I have absolutely no conflicts of interest whatsoever. All right, so please share this with your friends. You let your friends and family members know that there is somebody who really authentically cares about their health and is willing to put time and energy in to be able to share this message. I really want to make the world a better place, and I know it's possible. So I believe that Virgil was correct when he said this well over 2,000 years ago, that the greatest wealth that any of us can have truly is our health. As Aristotle said, a man who has his health has 1,000 wishes. A man who does not has but only one wish. So it's really important for us to have health. It really is. It's the most valuable asset we can have. Now, here's what we're going to cover today. I want to give you the outline. I want to share with you some of the statistics in the epidemiology, just a brief little look into that, so you can see the patterns, see how it fits. And then I want to share with you the context for health, the framework for what determines our health. When you understand the framework, it really makes a powerful difference in understanding what determines your health and why diabetes and other chronic diseases exist. Then we'll explore, based on new research, well, it's actually 15 years old now, it's 16 years old, the cause of diabetes, what we've actually been able to see at the cellular level, and what actually causes diabetes and all the contributing factors. And then, of course, what are the solutions? I want to share with you some really powerful solutions and the research that are really related to that. I'm also going to share with you a case study that I've worked on, somebody that I've worked with that has successfully reversed their diabetes completely, and all the resources so that you can have that as well. And then we'll finish up by talking about how you can make the rest of your life the best of your life. And it's really powerful to be able to make a successful lifestyle change. There's nothing like it. There's nothing like it. To be able to reclaim your health and to be able to have energy and vitality is amazing. And that's what I have today. And I'm really excited to be able to share that with people. So I'm going to ask you to be open-minded. And I want to let you know that I do not in any way, shape, or form claim to be the all-knowing expert. Okay, I'm not. I'm a student. I always have been, I always will be. Dr. Glover, he gave me some words of wisdom before I went off to medical school. He said, Ruben, about half of the information that you learn while you're in medical school will be outdated by the time you actually complete medical school. The other half will be outdated shortly thereafter. So he said, constantly be a student. And he really was such a profound role model for me. In fact, he practiced medicine until he was 86 years old. Pretty remarkable human being, really amazing. So I've always been a student. I have many teachers. One of my teachers has some words of wisdom to impart to you today. I will invoke his spirit here right now. You must unlearn what you have learned. So please be mindful of the wisdom of Yoda and be willing to unlearn, really. And that's going to be really the case here. I promise you, it's going to be unlearning what you have learned, because a lot of things that you've learned about diabetes, I promise you, have been completely opposite of what I'm going to share with you today. It really has been the case. So let's talk about some of the statistics and some of the things that we see relationship to diabetes. One of the things that I've noticed, and when I work with people, I've seen this, is that we see that obesity is definitely correlated with diabetes. In fact, we nowadays, many times, we oftentimes refer to diabetes as diabesity. So when we look at the relationship between body mass index, BMI, and mortality ratio, what we see is that as the BMI goes up, so does the risk for mortality. It really does. So that's one of the things that goes on. And why is this the case? So we look at the body and see what's happening. We see that there's two major types of fat that we can store in the body. One is what you're familiar with, is when you feel your body and you feel the subcutaneous fat. So how thick your folds are, all right, that's the subcutaneous fat, that's at the skin. That particular fat produces estrogen, which has been implicated and shown to be a major contributing factor for causing cancers. Now, the other type of fat is also what we call visceral fat or intra-abdominal fat. Now, this particular fat is what surrounds all the visceral organs. So your abdominal organs, your kidneys, your liver, your spleen, your heart, your lungs. I mean, you get fat all through that entire central cavity, the body cavity. So this particular fat produces inflammatory cytokines, and these are implicated with all the side effects from diabetes. So all the things that we see in diabetes as far as complications. So the vascular system becoming eroded and inflamed. You see the blood vessels in the eyes start to decay. You see renal failure and kidney failure. So there's all kinds of complications that are associated with diabetes related to this visceral fat. So when we look at chronic disease, what we see that so many chronic diseases are driven by the abdominal fat. All right, the inflammation is implicated in so many different diseases, and it's just prevalent. And it's not uncommon for people with diabetes to have other chronic diseases right along with the diabetes. So they can have multiple scenarios. They can have heart disease, they can have diabetes, and they can have cancer all at the same time. It can happen. So it's Dr. Dean Ornish, what he talks about is that chronic disease is all the same disease. It just has different faces. Now, one of the things that I looked at in my research when I was in medical school, I wanted to look at the relationship between obesity and chronic disease. How do they relate? How do they go together? So when I started looking at the data, it was interesting to see in the United States, we have the highest rates of obesity compared to all the other countries. So here's the United States down here. So we have the highest rates of obesity, and it's still the same way today. So we're extremely high. Now, if you moved here from a foreign country, bad move, just to let you know. Now, it's not getting any better. It's not getting any better. So for men or for women, the stats continue to show increases in all classifications of obesity. It has not gotten better at all. In fact, if we look at the data state by state, what's very interesting to note is that in 1991, all right, so just 30 years ago, 29 years ago, there was no state in the United States that had 20% obesity or more. None. But in 2010, I can't wait for the stats of 2020 to come out, but in 2010, there's no state in the union that has less than 20% obesity. That's remarkable. We can look at the data by county as well. You notice that the southeast portion of the United States has the most. Well, we can actually break that down by county, and guess what? This is the picture that we see in 2013. So the Southwest portion and the Midwest, all this area of the United States has the highest concentration of obesity by county. Now, I suggested a long time ago that this obesity correlates with chronic disease and chronic disease mortality. So if we look at the mortality from chronic diseases and all the leading causes of death, we see that the 10 leading causes of death, the latest statistics, 2015, 2016, from the Centers for Disease Control, heart disease and cancer still number 1 and 2 respectively. Injuries, chronic lower respiratory diseases, stroke. I want you to know Alzheimer's disease, I'm speaking on this next week, has overtaken diabetes now. We now refer to Alzheimer's as diabetes type 3, in case you didn't know. All right, Alzheimer's, the same mechanism as diabetes type 2, we call it diabetes type 3. Influenza and pneumonia, of course, this year, this is a complete different change with COVID. COVID is now, it's up there between 1 and 2 as far as the leading causes of death, depending on the time frame. Kidney disease and suicide. There is one major cause of death that's actually not listed by the Centers for Disease Control. However, Johns Hopkins actually did the research, and what they showed is that the third leading cause of death is medical error. And I can attest to this. For about a dozen years, I was in healthcare administration. I actually ran South Sacramento Kaiser Hospital for a while. And so the thing about it, one of my departments was risk management. And I can tell you, every single month we would review cases where there had been instances of medical error, and we had to review them to assess whether there was a potential risk for litigation. So this happens, and it happens frequently. It's the third leading cause of death, 251,000 deaths per year. That's over 250,000 people. That's amazing. So if we look at the leading causes of death, what is, and this is my question, what is the correlation between obesity and mortality due to chronic disease? So how do they match up? Is there a geographical relationship? So I wanted to take a look, and I did. I looked at the data from the Centers for Disease Control. So here's the map of the mortality by county from cardiovascular disease. And if you look, here it is, the southeast portion of the United States, similar pattern that has the greatest density of mortality due to cardiovascular disease. What about the number 2 killer? Well, that's cancer. We take a look, interesting. Similar pattern, geographically concentrated in the southeast portion of the United States. All right, let's look at the next killer, and that's lung disease. All right, so COPD and lung disease, again, we see the southeast portion of the United States, pockets in other places as well, but it's still rather consistent. What about stroke, another cardiovascular disease? All right, this one shocked me. You can see it very, very plainly. Stroke death rates in the southeast portion of the United States is very high. All right, what about Alzheimer's, which we're now referring to as diabetes type 3? And you can see it's very concentrated in the southeast portion of the United States and plenty everywhere else to go as well. And we're still gathering data. If we look at the incidence rate of diabetes, the concentration of diagnosed diabetes by county is again in the southeast portion of the United States. That's the highest concentration. We got it everywhere, but it's growing everywhere that we go. When we look at this relationship of this chronic disease to life expectancy, this next graph shocked me when I saw that the 10 states with the lowest life expectancy in the United States happen to be all geographically next to each other. Interesting. Interesting. In case you forgot your geography, Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Georgia, South Carolina, Tennessee, Kentucky, and West Virginia, all geographically next to each other in the southeast portion of the United States. Now, if you come from there or you have been there, you may have noticed that there is a difference in lifestyle in this part of the country. And I can tell you, I've spoken in Mobile, Alabama, Shreveport, Louisiana, Lexington, Kentucky, Louisville, Kentucky. And it's different. It is very, very different. In fact, I started to look at it. So if we look at the summary of the data, what we see is this. In the United States, heart disease, cancer, and stroke account for more than 50% of all the deaths. 86% of our nation's healthcare costs right now are spent treating people with chronic disease. That's preventable and reversible. Okay? 70% of all Americans are overweight or obese right now. 70 million Americans have hypertension with elevated risk for stroke and heart attack. And 100 million people, Americans, are projected to be diabetic in just 30 years, in 2050. 130 million Americans right now are affected by chronic disease. That's 40% of our population. And when you look at the workforce, that's over half the workforce is actually with chronic disease. Employers, I talk to employers all the time. I mean, it's devastating what that impact is. It's costing billions of dollars just from missed work. So if we look at diabetes specifically, what we see is that diabetes accounts to like 51% of the people 65 and over have prediabetes. 37% of adults over the age of 20 have prediabetes. This one is shocking. 4 out of 10 Americans are expected to develop diabetes during their lifetime. That's 40%. 40%. Can you prevent or even reverse type 2 diabetes? The answer is a resounding yes, you can. Absolutely. Now, if we go back to the data, is there a relationship between lifestyle and chronic disease? So I started to look. So one of the aspects of lifestyle is nutrition. So let's look. One of the things that really puts us at risk for chronic disease is having fat in the diet. So one of the things that we can look at is the consumption of, Kentucky Fried Chicken. Let's take a look at that one. Oh, here's the map. Look, lo and behold, the greatest concentration of consumption of Kentucky Fried Chicken is in the southeast portion of the United States. Wow. What about physical inactivity? We have a graph on that. All right. So when we look at physical inactivity, again, the southeast portion of the United States is highest in physical inactivity. What about stress? I was surprised when I saw this. Okay, frequent mental distress among US adults is also concentrated in the southeast portion of the United States and Fresno. And you know why if you've ever been there. All right. And then if you look at sleep deprivation, what you notice is that the southeast portion of the United States, again, has the highest concentration of poor sleep there and Las Vegas, of course, right? So the thing about it is that so people, and by the way, Kentucky's the worst state of all of them, okay? The most amount of Kentucky Fried Chicken, all right, no kidding, right? And then no movement, high stress, and no sleeping. By the way, it's not good to be in Kentucky. It is not good to be in Kentucky, all right? So why is it that we stay sick here in the United States? One of my good friends, Dr. Stephen Loam, he is a cardiologist, and he's also a lifestyle medicine physician, and he's in Chicago. And he says that there are 5 factors, that predominant factors that keep us as Americans sick. So one is that we're under a lot of stress all the time. There's so much stress. And when we're under stress, what our brain is wired to do is 3 things. 1, seek pleasure. 2, avoid pain. And 3, conserve energy. So we operate in what we're calling the sympathetic branch of the central nervous system. We're going to talk more about that in just a couple minutes. So when we're operating the sympathetic, then we shut down. We're not likely to exercise or eat healthy food or to have a good positive social network. No, we don't do those things. We regress, we climb back into our caves. Another thing that keeps us sick is our family patterns of behavior. Now, here's what's surprising. A lot of people think, oh, diabetes runs in my family, so I'm going to get it too. False. Heart disease runs in my family, I'm going to get it too. False. Cancer runs in my family, I'm going to get it too. False. What runs in your family are the patterns of behavior of your family. And what people do are the same behaviors over and over and over, generation after generation. And they eat the same foods and they have the same lifestyle factors. Those are the lifestyle factors. So genetics, think of it as genetics loads the gun, but lifestyle pulls the trigger. So genes don't necessarily indicate that you will get a particular chronic disease condition. Another factor that keeps us sick is the food industry itself. The food industry. I mean, do you really think for 1 minute that they have your better health as their number one objective? Think again. Doesn't happen. Another factor that keeps us sick, and it's been obvious these last 9 months, is the government. The government does not place public health as a priority. It never has. All right. Our government is run on being able to satisfy the needs of its benefactors. And I learned this a long time ago because when I was starting in healthcare administration, I worked for the state of California. And I realized that so much of what was dictated by health policy was influenced by lobbyists. And I would see this firsthand. The lobbyists would come into the director's office and influence the change of legislation. So I saw this firsthand. And then another factor that keeps us sick is the medical industry itself. As I shared with you before, Upjohn Pharmaceutical provided all the nutrition books and all the medical students in the entire United States. There's so much directed to pharmaceutical drugs. In fact, in the medical board exam, after the first 2 years of medical school, there were about 65 questions related to pharmaceutical drugs. There was only one question for nutrition. One. That was it. So the thing is, these keep us sick. Lifestyle medicine is committed to reversing this. Dr. Wayne Dysinger is one of the co-founders of the American College of Lifestyle Medicine, says this, that lifestyle medicine is the foundation of healthcare because 80% of healthcare is chronic disease today. It is. And 80% of chronic disease is caused by lifestyle. So if the disease is caused by lifestyle, the foundation of becoming healthier ought to be a lifestyle treatment. Doesn't that make sense? It certainly does to me. It makes perfect sense. So what we have to do is not count on the government to take care of things, not count on doctors who have learned about the whole pharmaceutically driven medical approach to take care of things, because they're not. What we have to do is we have to learn how to build resilience. We have to do this. So this is my friend Nehemiah Delgado. You take one good look at him and you can realize this is a resilient human being. All right. Resilience is the capacity to prepare for disruptions, recover from shocks and stresses, and adapt and grow from a disruptive experience. And this is what we have the capacity to do. We can build resilience no matter where we're at right now. We can start this journey. So I want to share with you the story of somebody that I've empowered to build resilience in her life. Her name is Angela. So Angela, let's see, it was August 31st, 2012. All right, so it was a little over 8 years ago. So I had coached Angela in swimming when she was 15 years old. And here it was several years later. And now she was 32 years old. And she gives me a call. And she said, Ruben, I need your help. You're the last person that I could think of that could possibly help me. And I said, what's going on? And she shared with me that she had been dealing with diabetes for quite some time. And that when she graduated from college, she started gaining weight. And she gained more and more weight because she wasn't training like she used to train. And so then what happened was she ballooned up to 300 pounds at 5'7". And her blood sugar was persistently over 100, and she started going up and up and up. And it got to a point where it was consistently over 200. And she was put on medications, and the doctor said, well, we got to try to manage this as best we can with the medication and see what you can do with exercise. And she started developing all kinds of symptoms, peripheral neuropathy. She couldn't feel her legs anymore, her feet especially. Started having difficulty with her vision. And when she called me in 2012, she realized from her blood work that her kidneys were starting to fail. She was very, very depressed about this because she wanted to pursue higher education. She really wanted to do well. She was an outstanding student and a nurse. She was actually a nurse. She actually knew a lot of stuff, but she was depressed about this whole situation. So I said, Angela, I said, I'm more than happy to help you, but I got to ask you a very important question. Are you willing to be as coachable as you were when you swam for me? And she paused, and she knew what that meant. Now, she was one of my most coachable swimmers. She worked so hard. And she said, yes, I will. I said, all right, let's go to work. I'm not going to promise you any quick fixes. There are none. This is a complete change in your lifestyle. You'll have to read, you'll have to study, you'll have to completely change your entire mindset about what you've learned before, and we have to unravel all of that. It will take that, and you'll have to be willing to be coachable. That's the most important thing. So if you're willing to do this, I am committed that we beat this, and I will work with you. If this is the last thing I do, we will beat this diabetes. So we went to work. And so what I'm going to do now is I'm going to share with you everything that I shared with her and then some. I'm going to give you the same information that I gave to Angela. And then when we get done, I will tell you the rest of the story. Okay. So we begin by looking at the context, the framework. What shapes our health? Now, this is something that's fundamental. Angela knew this, but this is something that most health professionals learn and then promptly forget after they take their board exams. So the context begins with this quote from my dear professor, Dr. Michael Kalitsky, who one day said this in class. He said, remember that all of life is in one of two states at any given moment. Either it is surviving or it is thriving. And that's all there is. And when he said this, that shocked me. I raised my hand. I said, I don't get it. I said, and Dr. Kalitsky said, just sit with it, Ruben, you'll figure it out. I hated when he did that to me. And he did that often, actually. So I sat with it for 3 years. So 3 years later, I'm in my first year of medical school at UC Davis, and I'm taking a class called embryology. So embryology is the study of the embryonic period of human development. So it's from the moment of conception to the point where everything is there. Now it just gets bigger, and we refer to it as a fetus after that. So pretty much most mothers will tell you they remember their first trimester. This is the first trimester. So embryology is the first trimester. And early on in our development, we look like this. It's a ball of cells, and all the cells look alike. You can't tell them apart. We call this the blastomere phase. But then the ball of cells gets bigger and bigger, and it gets to a point where it starts to fold inward, and it forms a tube of cells. This tube of cells we will refer to as the neural tube, and it will become the first organ system in the body to become distinguishable and operational. Now, you know, the first thing that gets developed in the human body is the central nervous system. So it gives rise to what we call the limbic brain, which is the hippocampus, the amygdala, the hypothalamus, the pituitary, all of those central features. And then it's all connected to the brainstem, through the brainstem to the spinal cord. So this is the central nervous system of the body. Now, the professor said, this is the first system to get developed and the first system to get activated. And once it is activated, it's on 24/7 for the rest of our lives. First system on, last system off. So it's always running the show, and it's running our body automatically. It does all the automatic operations of the body. Your heart is beating, you don't have to think about it. Your lungs are breathing, you don't have to think about it. Okay, your food is digesting, you don't have to think about it. Somebody needs to mute because we're getting feedback. All right, there you go. All right, very good. All right, so you don't have to think about it. This is the automatic software of the body, and it really is quite extraordinary. This is critical to understand when it comes to diabetes. Absolutely critical to understand. Now, here's what the professor said. Once this system is activated, it's on 24/7, and it is the electrical system of the body. Just like any electrical system, it's got two currents. It's got a positive current and a negative current. Just like any basic electrical system, you got a positive and a negative pole on your battery in your car. Same thing, same thing. All right, so the positive current of the body is called the parasympathetic branch of the central nervous system. When it is on, it is going to trigger and activate every organ system in the body and every cell in the body in a particular way. So when it is on, it's on for the whole body in this particular way. It's the positive current. It's the parasympathetic state. Think of it that way. The negative current is the sympathetic branch of the central nervous system. So when the sympathetic branch is operating, it's going to affect every organ system in the body and every cell in the body in the opposite way. This is critical to understand when it comes to diabetes, because when we are in the sympathetic state, we are reacting to stress of any kind: physical, emotional, mental, spiritual stress. Any of those four stresses will trigger the sympathetic state, and it's automatic. You don't have to think about it. It will happen. We are going to be in the state of survival. We're operating from a very primal state, and we may recognize fight, flight, freeze, or fold as reactions that can occur when we're in this state. However, even as subtle as a perceived threat, which is defined as fear, is enough to trigger and put us in the sympathetic state. These days with COVID-19, there's so much of this going on. Of course, their stress scales are off the chart. What we see in the literature is this, that the common thread of all chronic disease is being in the state of dis-ease far too much. Far too much. So think about you. Think about diabetes. Think about how being diabetic and being in your life, you have been in the sympathetic state far too much. Far too much. That's the common thread of all chronic disease. Now, our sympathetic branch is designed to be in that, we're designed to be in the sympathetic state only for short periods of time. So any chronic disease, heart disease, cancer, diabetes, Alzheimer's, gout, fibromyalgia, chronic fatigue syndrome, multiple sclerosis, the list goes on. Any chronic disease condition, the common thread is being in the sympathetic state far too much. What lifestyle medicine is all about is empowering you to be able to tip the scales. We want to tip the scales from being in the sympathetic state far too much to being in the parasympathetic state more of the time. That's what we're out to do. And if we can be in the parasympathetic state more of the time, our body experiences peace, pleasure, restoration, digestion, fun, play, and ease. Yeah. But here's the deal. We start to thrive. And our body heals itself. It heals itself far better than any medications could possibly ever do. And you already know this. You already know this. I mean, when you were little and you played and you scratched yourself or scraped yourself playing around, you went crying to your mother. I know I did. All right. And then I dreaded telling my mother that I scraped myself because she would pull out that darn mercurochrome and put that one on, stung like crazy. All right. And then she put a Band-Aid on, say, leave it alone. Don't touch it. A week later, took the Band-Aid off. All healed. All better. Amazing. The body can heal itself externally with a scrape, but we can heal ourselves internally if we give our body the right environment, the right conditions. And that's when we are actually able to experience being powerful. So we're able to do this, and it really is amazing. Now, I have a seminar, I did it a couple of weeks back, and it's called The 5 Secrets to Living a Thriving, Healthy, Happy Life, where I talk about 5 factors, 5 behaviors that you have total control over that can influence whether or not you're in the sympathetic state or the parasympathetic state, because we have power. We do. We have power. So the 5 secrets, I'm just going to give you the one slide to summarize these 5 secrets. So the 5 elements that influence our nervous system state more than anything else. Number 1 is the thoughts that we think. If we've got stinking thinking, we'll be in the sympathetic state, just like that. So we have to use the power of positive thinking. It's very important. Norman Vincent Peale taught me that very well. So it's real important for us to manage our thoughts. Secondly, consistent with our thoughts are the words that we speak. If we're complaining, if we're gossiping, if we're being critical, cynical, skeptical, guess what? We're going to be in the sympathetic state immediately, just like that. It's super fast. So if we use positive words, if we use our words to uplift and encourage and support, those words will keep us in the parasympathetic state. And it's not only the words that we speak, but it's also the words that we listen to as well. So for that reason, Norman Cousins taught me something a long time ago. And as a result of his incredible book, The Anatomy of an Illness, I stopped watching the news over 35 years ago. Haven't watched the news since. Don't watch it. Why? Because it's the same stuff every day and it's depressing. All right, so don't watch the news. Third is the actions that we take. Actions speak louder than words, don't they? And if you're a parent, you've already learned the lesson. Our children do not listen to what we say nearly as much as watch what we do. Yes, totally true. So this is about being able to be true to ourselves. So if we make a promise to ourselves, and the moment we let ourselves off the hook, immediately we have a breach of integrity with ourselves. We're in the sympathetic state. So this is why the practice of integrity is so critically important to health. We have to be able to honor our word at all times for everything. Fourth is the company we keep. We've shown the research this, that we are most dramatically affected by the 5 people we most associate with. And in that circle of 5, if we are surrounded by people who have stinking thinking, who are cynical, skeptical, and critical, complaining and gossiping all the time, that's going to pull our energy, guess what, into the sympathetic state. So we need to be mindful of who we associate with. Now, sometimes it's difficult. I know. Sometimes these people could be your family. I know. Okay. So the thing about it is that you have to be responsible for building up this inner circle of 5. It doesn't mean you stop loving the people that are in your life that are really cynical and skeptical and negative. No, you just love them from further afar, but you build up this inner circle of 5. And that's what I have spent years really building this up. I built up this inner circle of 5 and even another circle around that. It's been remarkable what that has done in my life. And then the fifth element that influences our central nervous system state is the food that we eat. We're going to talk about this because food actually affects us neurologically just like everything else does. Food affects us neurologically. Most people never think of it this way, but food can either put us in the sympathetic state or the parasympathetic state. And I'm going to distinguish that for you so that you understand how that works. Most people never think of it, but it does. Now, the next time you go to once COVID is over and we go back to socializing and you go out to the next year's family gatherings, probably next Christmas, you're going to go to the parties and people are going to pass the hors d'oeuvre tray. And what you're going to do the next year is you're going to ask, will this hors d'oeuvre put me in the sympathetic state or the parasympathetic state? Now, if they give you funny looks, that's okay. All right, so it's perfectly fine. But we're going to talk about this. All right, so now let's talk about diabetes because we got lots to cover. So what is diabetes? Fundamentally, it's referred to as insulin resistance. So insulin is the hormone that our body secretes from the pancreas in order to allow sugar, glucose, to enter the cells. So we need that as a cofactor. It's basically, think of it as insulin is the message. It's the foot, the pressing down on the gas pedal. So insulin is the foot putting pressure on the gas pedal to tell the carburetor to open up, to put gas and have more gas flow into the engine. All right, so insulin is the initiative of the foot pressing on the gas pedal. Now, there's different types of insulin. All right, there's type 1 and type 1.5, which is late onset diabetes. So what we now refer to is latent adult diabetes. So those are considered autoimmune, but I'm going to show you that this whole process that I'm going to share with you improves type 1 and type 1.5 dramatically, improves it. Now, there's also type 2 diabetes and prediabetes, which are developed from lifestyle factors. So that's what we're going to dive in mostly on that. Type 3 diabetes or Alzheimer's, I'm going to share that seminar next week. Don't miss it. It's powerful. And then there's also what we refer to short term is gestational, which is during the process of pregnancy. And there's polycystic ovary syndrome is another condition that's related to diabetes as well. Sometimes they go together. All right. So these are the things that are related clinically. But the question is this: what is the cause of diabetes? Now, when I was in medical school, it was etiology unknown, which means we don't know what causes it. That's what the explanation was in the pathology class. But we now know a completely different picture because we didn't have the science back then to understand it clearly enough. So to understand, we have to first look at what helps a cell works properly in its normal physiology. So to do that, we have to understand how energy is produced inside a cell. So this is a very simple diagram from a biochemistry textbook. So energy, so diabetes affects energy. And this is why so many people that have low energy in chronic diseases, this is what we have to cover. So the energy molecule in the human body is this one right here, ATP, otherwise known as adenosine triphosphate. To produce this, optimal production of ATP is through the mitochondria, which are the pistons of the engine. They're these little organelles inside of our cells. Now, when we have the presence of oxygen, the mitochondria work fabulously, and they're amazing little organelles. They do such great work, and they can produce more ATP than we can otherwise, in what we call glycolysis. So in order for the mitochondria to do their job, we need just a little bit of fat, a little bit of free fatty acids, we call triglycerides, and we need this molecule here called pyruvate. So pyruvate is half of a glucose molecule. And we got to get that pyruvate from a very specific process from this particular human complex carbohydrate called glycogen. We must get pyruvate from glycogen. We must get it from glycogen. You cannot just eat sugar and get the pyruvate. It's not going to work that well. Okay, we need the glycogen, which is the human gasoline station inside the cell. So it's the human gas station. Okay, so this is the gas pump right here. All right, so this is what we got. We've got right there is that glycogen, which you cannot buy in the store. We have to manufacture it. So we take the glycogen, break it down, clip off a glucose molecule and split it into pyruvate. That's called glycolysis. All right, now glycogen can only be formed by two specific carbohydrates. There are many, many, many different kinds of carbohydrates. A lot of people say, oh, carbs are bad for me. But that's not a specific enough term. Don't say just carbohydrates. There are two specific carbohydrates that human beings must have. Two, count them, two, amylose and amylopectin. Amylose and amylopectin, the two specific carbohydrates that we as human beings must have in order to formulate glycogen in the cell to be able to store it. Now, amylose and amylopectin, I'm sure that you have never seen a food label that says high in amylose and amylopectin, good for your diabetes. I'm sure you've never seen that. I never have. What do you see in the supermarket? High in protein, high in calcium, high in vitamin D, high in all these other things that they're trying to market to you. You know, it's interesting. I got to tell you this. I had a conversation with my son number 3, who's at Cal Poly San Luis Obispo. He's taking a class in marketing. And he says, Dad, it's so disheartening. I'm learning that marketing is so manipulative. He says, yeah. I said, yeah, that is absolutely the case, because so much of marketing is manipulative to help market their products and feature the one thing that, or the two things that will somehow appeal to you to buy their product with no consciousness of the rest. So realize that's how the world works. So nobody's marketing amylose and amylopectin, which is what we need. Nobody's marketing that. So now this is how a normal cell works. We need to get amylose and amylopectin. I'm going to come back to them later. Now, where does the problem come in? So the problem is this, that now back in medical school, when I was there, my advisor was Dr. Peter Calla. He's still there as an emeritus professor. He's brilliant in cellular physiology. Now, what we knew back in the 80s was this, that if there's blood sugar is out in the cells and out in the periphery of the cell. So this is a cell. And then what happens is that in order for the blood sugar to come into the cell, it has to pass through these gates, glucose channels. Now, in order for these channels to open up, they have to get a signal that says open sesame. This signal is going to come from the insulin receptors that are also on the cell membrane. The insulin receptors, in order to be triggered to send the message, have to have the insulin molecule come into the insulin receptor site on the outside, and then they have to bind to that site. Insulin gets secreted from the pancreas when our central nervous system says, I need to move, I need more energy. All right, so that's what happens. So this morning, so just to give you an example, I mean, this morning, you know, you woke up and you were still lying in bed and you had this thought in your mind, oh my goodness, today I get to listen to Coach Ruben talk about diabetes. This is going to be a remarkable day. So as soon as you had that thought, all right, your brain sent a signal to the pancreas to release insulin. Insulin flooded into the blood vessels, went to the muscle cells, binded to the muscle cells on the outer surface on the receptor sites, sent the signal that said, open sesame to the glucose channels. Glucose channels opened up, glucose went flooding into the cell, and then the glucose went to the mitochondria to get processed to create adenosine triphosphate. Boom, you had energy and you jumped out of bed. So excited to listen to me today. Now, all of that took about 2 seconds. It's remarkable how this whole system works. Now, back when I was in medical school, we started to notice that, well, I mean, we were talking about it. If the glucose in the bloodstream was high, because see, the central nervous system regulates the amount of glucose in your bloodstream all the time. It's supposed to be about, generally speaking, about 75 to 100 milligrams per deciliter. That's the right amount of glucose. Why? Because you need the right amount in order to feed the brain. The brain runs on glucose. The rest of your body runs on glycogen. Okay? Now, here's what happens. We need just a very small amount of glucose in the bloodstream to feed the brain. That's it. Okay? We need the amylose and amylopectin to feed the body. I want to distinguish that so you understand the difference here. It's real important to understand that. So the brain needs just a little bit of glucose. In fact, my eldest son asked me one day, he said, Dad, how much sugar is that? And we did the math. For an average person, 5 liters of blood, 80, we figured out 90 milligrams per deciliter. That works out to be about 1 teaspoon of sugar for the entire body. That's it. That's for your brain. You need 1 teaspoon of sugar. You don't need to take it in. You take in 1 packet of sugar, you now doubled your system, you overloaded the system. Okay, you put it into shock. All right, it immediately goes into the sympathetic state. It is automatically regulated by your central nervous system. You don't need to try to manipulate it. Don't do that. It's not good. Okay, so that system is completely monitored by the central nervous system all the time. It's completely monitored and regulated. Now, when we start seeing people where the glucose starts climbing up, 130, 180, 200, 250, 300. I had a friend of mine, she's a hospitalist. She had a patient come into the hospital with a blood sugar of 1400, comatose, okay? Not good. So there are complications when the glucose levels get up too high. Inflammation, there's all kinds of problems. It's ridiculous, all right? There's so many problems when the glucose levels get up. So what we've been doing for years, so what we've said is there's something wrong here at the insulin receptor junction. That's what we've been saying all these years. There is insulin resistance. There's resistance for the insulin receptor in accepting the insulin hormone. So we're going to jam some drugs in there. We're going to jam some artificial insulin or some other animals' insulin, or we're going to jam, some metformin or some other drugs. We're going to jam that system. We're going to get that system to work. So we've been doing that for decades. And we've never reversed diabetes, never reversed diabetes, never reversed diabetes. Now, I was taught in medical school that if I diagnosed diabetes in a patient, I had to be responsible and inform them that they were going to need to be on medications for the rest of their life. That the best that we could do was manage their diabetes with diet, exercise, and medications. Now, my good friend, Dr. Neil Barnard, his father was a physician who specialized in managing diabetes. And he watched his father come home every single night depressed from never being able to really help any of his patients. So in 2004, at Yale University, I'm going to send you the research, there was new technology that was developed to be able to look inside the cells in a live situation. I had this very ultra high resolution magnetic resonance, so we could actually look inside the cells. And when they looked inside the cells of diabetics, it was a shocking picture, because what happened was that we found this, all of these pockets of intramyocellular lipid. Now, this was shocking because intramyocellular lipid is a fancy word for fat. Inside myomuscle cell, lipid is fat. This is shocking. Why? Because the cell normally on the inside, muscle cells on the inside are normally about 90% water. But lipid is fat, which is oil. So think for a moment. Do oil and water mix? No, they do not. I mean, almost everybody knows this. This is simple, basic chemistry. I mean, it's really, and you can do this at home. All right, take a glass of water, take a glass and put oil and water in the glass. Where does the oil go? It goes to the surface. It forms a slick on the surface. It separates from the water. Okay, what happens out in the ocean when an oil derrick breaks or a tanker leaks? Where does the oil go? It goes to the surface. And what happens to the marine life underneath the surface? It suffocates and goes belly up and dies. So this finding at Yale University is so shocking because what we realized for the first time, the cause of diabetes is not on the outside of the cell, it's on the inside. It's the fat that's on the inside, and it's forming an oil slick on the inside of the cell, causing a slick on the inside of the cell, suffocating the cell from the inside. It's not from the outside. So you can add all the drugs you want. It's never going to reverse the diabetes until you deal with the oil slick on the inside. Does that make sense? I hope it does. So my good friend, Dr. Neil Barnard, he saw this research and he said, oh my goodness, this is profound. What if I do a clinical study? Now he was a professor of medicine at George Washington School of Medicine. He still is. And he's the president of the Physicians Committee for Responsible Medicine. And so he designed a clinical study. So what he did is he took 99 diabetics and he randomly assigned them into two groups. One group, he put them on a plant-based, low-fat vegan diet, less than 20 grams of fat a day. The other group, he put them on the standardized American Diabetic Association diet. You know that one, it's high protein. All right, so you got meat, dairy, and eggs in that one, so high protein diet. Now, he did this for just 22 weeks. And so then here are the results. The low-fat vegan diet, plant-based diet, decreased their meds by 43%. Those on the American Diabetic Association decreased it only by 26%. So twice as effective with the low-fat vegan diet. A1c improvement. A1c is the long-term measurement of glucose load. So low-fat vegan, 1.2% decrease, whereas the American Diabetic Association only 0.4%. Body weight difference, low-fat vegan, 6.5 kilograms. American Diabetic Association lost less weight, half as much, 3.1 kilograms. Cholesterol also improved, 21% in the low-fat vegan, American Diabetic Association only 10%. So what we saw is improvement on all of these markers. It was remarkable. Here's the graph in terms of the A1c. All right, so what we see is the A1c dropped dramatically over time with the vegan plant-based diet, whereas the ones who had the American Diabetic Association diet, they decreased a little bit, but then started to increase. Dr. Neil Barnard then extended this research study for another additional year. So he made it a 74-week study, 74-week clinical trial. He extended this at the George Washington University School of Medicine. All right, so then here are the graphs on the A1c. All right, so that after a full year, big difference. All right, and then what we see also with body weight, also retained a large difference. And then also with low density lipoprotein, which is the biggest factor for heart disease, what we've seen is LDL cholesterol. And this is the biggest difference, so huge difference there. So when it comes to diabetes, what we see clinically is that the biggest culprit is excess fat in the diet. Excess fat in the diet. Well, people are wearing it on their bodies, and then so I mean, this is what Dr. McDougall says: the fat you eat is the fat you wear. Now, in the United States, when it comes to eating and consuming fat, it's obvious we have a problem here in the United States. The United States ranking #1 in fat consumption in the world. We're amongst the top. The standard American diet, when we look at the data from the last 50 years, 1970, only 338 calories from added fats and oils. In 2010, that rose up to 562 calories. We'll see what it is in 2020, because I have a feeling it's going to be a lot more than that. If we look at the calorie intake, this increase in calories, this total increase in calories, about 48%, nearly half of the increase in calories that we've seen from 1970 to 2010 has been from fat, And when we look at the data, we also see this, that when we look at the prevalence of diabetes related to weight, all right, so what we see is that diabetes in red and mean body weight in blue. And so we've seen is that as weight has increased, so has the risk of diabetes. That's why we refer to it as diabesity. Now, a lot of people have said, well, it's got to be the carbs and the sugar. We've got too much sugar in the diet. That's the problem, because the blood sugar going up, my friends, is a symptom. It's not the cause. It is a symptom. When we've got the oil slick on the inside of the cell, now the insulin receptors can't work and the glucose can't get in. So now the blood glucose absolutely goes up, but that's a symptom. It's not the cause. I hope you get that. All right, so it's real important to understand. Now, if we look at the data, it's very clear. All right, sugar intake, if sugar was the cause, we would see that if sugar consumption has gone down, we would also see obesity and diabetes going down concurrently. But we don't see that. We don't see that. All right, same thing with carbs. A lot of people say the problem was the carbs. Well, carbs has gone down since 2000. If carbs was the cause of diabetes, we would see a decrease in obesity and diabetes concurrently. But we don't see that. It's interesting when we look at fat consumption, because when we look at the trend of fat consumption and obesity prevalence, and we see that there is a tendency, there is a relationship. The highest increase has been of fat, and the biggest contributor to that has been vegetable oils. Vegetable oils. All right, we're adding oils to everything in our cooking. It's added to foods. It's in our processing. It's in vegetable oils, is in everything. You can't pick up almost any product in the supermarket today if it's a processed food and it's got oil in it. Read the labels. It's got a lot of oil in it. In fact, when we look at the data in the United States, salad and cooking oils have increased 348% since 1970. That's remarkable. Okay, total added fats and oils have gone up nearly 70%. So that's a huge increase. Now, I don't want to teach you biochemistry today. I don't have time. But I want to share with you just simply why this is the case. These are 4 different fat molecules. Not all fats are the same. At the bottom here is a polyunsaturated fat. It's called alpha-linolenic acid, an omega-3 fatty acid. Now, C represents the carbon atom, H represents the hydrogen atom, O represents the oxygen atom. This particular fat molecule, this alpha-linolenic acid, has a unique feature, a very special feature. It has carbon attached to another carbon with a double bond. Carbon can normally attach up to 4 other atoms. However, in this case, there is a high energy double bond with these 2 carbons, this one here, this one here. So you've got 3 carbon-carbon double bonds. Why this is so special is because this high energy bond can be broken open. We have enzymes in our body that allow us to do that. And then we can reconfigure and reuse this fat to structure other molecules that we can use, such as hormones and enzymes and all kinds of other things. So we use it in the manufacture as a building block. So this is a very healthy type of fat for us to be able to have. It's an omega-3. This up above of that is a linoleic acid, which is has 2 carbon-carbon double bonds. And it's an omega-6 because the first carbon-carbon double bond is on the 6th carbon, whereas on the bottom one, the first carbon-carbon double bond is on the 3rd carbon. That's why it's an omega-3. So this one actually is, if it's in plants, it's anti-inflammatory, but if it comes from animals, it's inflammatory. Now, this one, the monounsaturated fat, has only 1 carbon-carbon double bond, and guess what? That is inflammatory as well. The one that's really problematic is this one at the top. This is a fatty acid. This is called palmitic acid, and it is a saturated fat because every carbon is saturated with adjoining hydrogens. So it has no carbon-carbon double bond. Therefore, it is biologically dead to us. We can't do anything with it. It is an inert type of molecule. We can't do anything except one thing, and that is roll it up to actually manufacture more cholesterol, which we don't need. We don't need. All right, so this saturated fatty acid has the same biochemical properties because of the hydrocarbon strand, has the same biochemical properties as these modified fat molecules. In case you didn't know, these come from fats. Crude oil is from dinosaur fat. Yeah, comes from dinosaurs. Yeah, we refine it to produce plastic, motor oil, diesel fuel, and gasoline. Now, so we shouldn't be adding these to our diet, don't you agree? Probably not a good idea. So we want to make sure we stay away from these saturated fats. In particular, here's what we're facing in this country. The average American consumes 161 grams of fat per person per day. If you were to purify that as just oil, that would be about 3/4 of a cup of oil per person per day. That's ridiculous. We can only metabolize so much fat, and it's different for each one of us. And it depends on how healthy and fit we are. A collegiate athlete like my youngest son, who's 20 years old, he's a swimmer at UC Santa Cruz. He burns, actually, we figured out about 75 to 90 grams of fat a day. That's how much he needs. That's how much he needs. He has to do it. And we want all healthy fats, predominantly omega-3s, right? That's what we want. Whereas a fit active adult, maybe 40 to 60 grams of fat a day. If you're unfit, a low active, 20 to 40 grams a day, maybe. And then if you're overweight or obese, you have chronic disease condition like diabetes, your goal, your mission, should you choose to accept it, is to have your fat content be less than 20 grams of fat per day. 20 grams of fat or less per day. Now, 1 tablespoon of oil is 14 grams of fat. That's 1 tablespoon. All right, now it can be done. Dr. Neil Barnard's research study, they averaged 17 grams of fat per person per day. That's what they were able to do. So let's look at the major sources of fat. This is really what we have to be able to look at. All right, because now it depends on you. My youngest son, he needs fat. He can get away with the avocados, no problem. All right, but he doesn't have any oil in his diet. That's really important. All right, so all oils, absolutely nothing but 100% fat. You don't need any of them. I don't care what anybody else says. The marketing is marketing, all right? You do not need any of these. I don't care how crude or cold processed the olive oil is. No, you don't need any of it. It's all man-made. You don't need any of this at all. There are no trees on the face of the planet that have bottles of olive oil or any other kind of oil hanging from their branches, okay? It's all man-made products. Don't need it. And we don't need any foods that are fried in oil either. Okay, so that includes all the hush puppies or the French fries or the fried chicken or the fried fish, whatever the case may be. Stay away from that. That's where you just concentrate the oil. Oils have absolute deleterious chemistry on the body. They cause all kinds of problems to the arteries, to vasodilation, increase triglycerides, decrease your oxygen transfer. It causes sympathetic response immediately, increase inflammation, increase cholesterol. Not good. There's none of it that's good. Dr. Esselstyn says it well. I'll invoke his spirit right now. no oil. Okay, I hope you all got the message. Okay, so no oil. Okay, now another major source of fat is going to be all meats, Okay, now our ancestors didn't eat this way. They had lean wild game. All right, that's why they didn't get the diabetes, because they had lean wild game. They were eating, and they caught it. They were lucky to catch a rabbit every week or so. All right, so the thing is, we have all these meats. In particular are the processed meats. Processed meats are loaded with fat. Oh my God, they're horrible and they're carcinogenic. So stay away from that. We want to stay away from that. We've also got research on the eggs. So what we showed in a 2016 meta-analysis of 12 cohort studies, over 200,000 subjects, there was a 39% higher risk of diabetes mellitus, type 2 diabetes, comparing highest with lowest egg consumption in the United States. Stay away from the eggs. All right. And another source of fat is going to be all dairy, including milk, butter, cheese, yogurt, cottage cheese, ice cream, all of it. All right. Stay away from it. Cheese is made from the milk fat. It's about 70% fat or more. All right, so don't go to the cheese. A lot of people have problems with the cheese because it's so addicting, I know. Okay, so stay away from the cheese. Another major source of fat, even though these are healthy fats, they're healthy fats. A lot of people say, well, don't we need healthy fat in our diet? Well, the thing is, if you're diabetic, you need to have all your fats come only from healthy sources, but less than 20 grams of fat a day. That's your objective. All right, so healthy fats, nuts, seeds, and avocados. But for you, you need to watch out for these. All right, if you're diabetic, one avocado is 30 grams of fat. It adds up very quickly. All right, one handful of nuts and seeds, all right, anywhere from about 14 to 22 grams of fat. So it adds up very fast. So you want to be mindful of this. Even though these are healthy, concentrated sources of fat, you don't need to have them in your diet if you're trying to beat diabetes. All right. In addition, I'm going to send you this list. This is the list of all the highest fat foods. All right. All of these fats and oils, animal products, nuts and seeds, fruit, there's olives and avocados are high in fat, seafood, dairy and egg, and baked products. So you want to stay away from all of these. All right. You want to just completely cut them out. Another culprit. It's the symptom, but you want to also attend to it. You want to avoid refined sugar. Absolutely get rid of anything with refined sugar in it. It looks like a drug, sounds like a drug. Guess what? It is a drug. So refined sugar causes all kinds of problems. And bottom line, with refined sugar, it gets stored as fat. All right, so you want to stay away from it. It promotes inflammation and it triggers the sympathetic branch of the central nervous system. You also want to stay away from all processed foods. I don't care if it says lean cuisine or healthy choice. That's marketing. All right. Don't go there. All right. That's all processed food. So you want to stay away from that. Alcohol is also problematic for a diabetic. Absolutely problematic. All right. It really is. Now, here's what happened. The research was done years ago by the alcohol industry. And what they did is they said this famous J curve. They said, oh, if you have moderate alcohol, it actually leads to a decrease in mortality. But there was a problem because they had 4 groups that they looked at. They looked at the abstainers, moderate consumers, heavy occasional, and heavy regular. But there was a problem with the research. The abstainers weren't just abstainers. There were 2 groups of people that comprised the abstainers. So one were people who were truly abstainers. They didn't really drink much alcohol at all. But the second group were people who were currently in Alcoholics Anonymous. Like, really? Are you going to include those people in your study? Would you include former smokers as abstainers from smoking? I don't think so. So that's faulty research. So what we did is we actually teased out the data and we took out the people from Alcoholics Anonymous, and we end up with this blue line that there is a straight line progression of increased alcohol consumption and increased mortality. In fact, I will share with you this statement that just came out of August of this year from the American Medical Association. So we go down to the bottom here. There is no safe threshold for alcohol and cancer risk. Why have diabetes to go along with your cancer? No, Does it make sense? The consumption of up to 1.5 drinks per day accounts for an estimated 26 to 35% of all alcohol attributable US cancer deaths. Don't go there. All right, now, what does work? Because now I've thoroughly depressed you. Okay, so what does work? So to understand that, let's go back to understanding how the body actually does work when it works really well. So the cell is the fundamental unit of the human body, and it's an energy system just like a car is. So the engine of our car is the mitochondria. Those are those pistons of the engine. The more we have, the better our engine runs, the more power we have. Protein is not for fuel. I have to tell you this. I have to get this through. This is one of the things you have to unlearn. Everybody says protein, 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 protein. I'm a diabetic. I need to have high protein in my diet. Get rid of that notion. That's a completely false statement. Completely false. Protein is for parts. It's for infrastructure. All right. You would not put nuts, bolts, screws, and washers in your gas tank of your automobile. No, you wouldn't do that. Protein is for parts. You only need a small amount, and there's no deficiency. Make sure you attend my Truth About Protein webinar. All right, now, what we need for fuel, for the human body to work, we need a little bit of triglyceride. This is the fat. We need a little bit of that. This is the oil. And then we need mostly glycogen formation. So we need to formulate the right fuel for glycogen. So we need the amylose and amylopectin. That's the complex carbohydrates that we need. This is our gasoline. This is the oil. We are a diesel engine. We are a diesel engine. We need the right mix. You have too much fat, get too much oil, you're going to gum up the engine. All right. It's going to smoke like crazy and it won't run properly. You have it too lean. All right. You're going to burn the engine. So we need to have the right fuel mixture for our engine to work properly. So go back to this engine diagram again. So we go back to this. We need amylose and amylopectin. Those are the two specific complex carbohydrates that we must have in our diet to formulate the glycogen that gets converted to pyruvate, which produces adenosine triphosphate, the energy molecule of the human body. Amylose and amylopectin, they are the structural, molecular structural diagrams. So every circle represents a glucose molecule. So amylose is this spiral molecule, and amylopectin looks like a tree. We have an enzyme called amylase. It's in our saliva. It helps to break this down right away so that we can start to formulate it into glycogen. Amylose and amylopectin, you probably never heard of them before today, but they're otherwise known as starch. Starch, you probably heard of starch, but starch, yeah, this is the cover of the scientific journal, Starch. There are scientists that actually study how to use this. What it looks like for you and me, well, legumes, beans, peas, lentils. All right, there are over 2,000 varieties. You can't possibly get bored. All right, now that's legumes. And then whole grains, not processed grains, not flour. All right, we're talking about whole grains. So corn, millet, spelt, amaranth, steel cut oats, brown rice. I mean, there's tons of whole grains. They're wonderful. You can eat those. Yes, you can. Starchy vegetables, fabulous. Potatoes, over 4,000 varieties developed by the Incas in South America. Squashes, sweet potatoes, all kinds. People love potatoes. I certainly do. All right. All plants produce starch. All plants do, including all vegetables. In case you forgot what they look like, here's a picture. All right. So there's what we need. And then fresh fruit. Yes, we actually have research studies taking diabetics and putting them on a fruit-only diet. A fruit-only diet. No fat, fruit only. Their diabetes went away. Yes, you can have fruit if it's whole fruit. That's what we want to be able to do. It's amazing. So the benefits of this approach, amazing. I mean, there's so many benefits to this. It's extraordinary, really incredible, and it works. Remember this, the neurological connection to food, that the food that you eat can either be the safest and most powerful form of medicine, or it's the slowest form of poison. You're an adult, you get to choose. You get to choose, but this is a law. This is how it works. Okay, so you get to choose how it's going to be. You want to suffer? Some people love suffering, all right? They really do. They love suffering. They'd rather suffer than change. So that's a part of the condition of the human condition. People would rather suffer than change. But if you choose, you can actually have the most powerful form of medicine, which is the proper food. Because every time you eat or drink, you're going to either feed disease, you're going to feed disease, or you're going to fight it. You get to choose. Now, here is my food pyramid, which is based on the neurology of food. So the neurological impact of food. So food that is in meat, dairy, oils, processed foods are going to cause inflammation immediately. They will cause that. Refined sugar, deep fried foods, all sodas. Legal drugs include nicotine, caffeine, and alcohol. And then excitotoxins include MSG and aspartame. Those are all going to cause toxic reactions in the body very quickly. My recommendation is to minimize or eliminate all of these foods. If you're diabetic and you really want to be able to heal, you've got to eliminate them. Really work towards doing that. Make small changes, but work towards doing that. What you want for a parasympathetic diet is life-promoting foods, starchy veggies, whole grains, legumes, greens, colorful veggies, and fruit. That's where you want to play. Play there. That will make the biggest difference for you. What we show is this from the Physicians Committee for Responsible Medicine, is that a diabetes diet doesn't mean a no-carb diet, right? Remember, this is very different. There's different kinds of carbohydrates. Ditch the overly processed carbohydrates made with sugar or white flour, like Twinkies or many breakfast cereals. Instead, pick whole foods, not processed foods, whole foods such as potatoes, rice, oats, beans, whole grain pasta, fruit, and vegetables. And it's remarkable. With the right spices, all of it can taste fabulous. It really can. A diet change beats a pill every single time. Every single time. A plant-based diet improves blood sugar, body weight, blood pressure, and cholesterol all at the same time, which is something that no drug can do. None. So really, you owe it to yourself. Now, one of the healthiest groups of people on the face of the planet are the Seventh-day Adventists that live down in Loma Linda, Southern California. They have one of the longest life expectancies on the face of the planet. They have one of the highest concentration of centenarians. Now, there is a bit of discrepancy on how they eat. So it's a very interesting population group to study. So we've been studying the Adventist group because some of them are very, very strict in following a whole food plant-based diet, and some are a little bit less strict. So we've been able to look at that, and it's very interesting. When we look at the data from the Adventist Health Study, we have over 60,000 participants over the age of 30. And this is a 4-year follow-up. And what we show when we're looking at this healthy group, that the non-vegetarians have a rate of diabetes of 7.6%. Okay, they're non-vegetarian, meat, dairy, and eggs. And we have semi-vegetarian, pesco-vegetarian, meaning fish, lacto-ovo-vegetarian, meaning milk and eggs. But then the vegan, so no animal products whatsoever, had the lowest diabetes prevalence, and it's remarkably different. It's remarkably different. So this is with a very healthy group of people that we've been able to fine-tune the difference. Okay, so that's very important to see. Diabetic neuropathy, just so that you know, a lot of people have developed this. This is one of the complications. So what we've seen in the research is that diabetic neuropathy, which I was taught in medical school, that once you have neuropathy pain, you're done. You cannot reverse that ever again. But we show that with a low-fat plant-based diet, it absolutely can be reversed. So we took 21 patients with known adult onset diabetes mellitus, all right, and we put them on the vegetarian diet, and complete relief of the pain, the peripheral neuropathy pain, occurred in 17 of the 21 patients in 4 to 16 days. That's amazing. That's amazing. All right, really amazing. In this study, okay, so this study, which was published in Nutrition and Diabetes, a plant-based diet reduces the pain of diabetic neuropathy, according to new research published today in Nutrition and Diabetes. So we have another study that actually shows that as well. In Canada, because they have universal health care in Canada. Now, the Canadian Journal of Diabetes and the Canadian Diabetes Association, they reviewed over 13 studies, and they say this: researchers call on clinicians to provide more frequent and standardized nutrition education and support for plant-based diets as diabetes treatments. As diabetes treatment, okay, not pills. No. Okay, plant-based diet as diabetes treatment. All right. Now, it's really going back to the wisdom of what Hippocrates said well over 2,200 years ago, that let food be thy medicine. Let food be thy medicine, and medicine be thy food. Let food be thy medicine. Now, another thing that can really help, and now I do this with all my clients, there's many aspects to reversing diabetes. All right. Now, that is this. What we show in the research is that if you eat, you want to take a short walk after you eat. Okay, 3 short walks after eating is actually better for managing your blood sugar control than taking 1 long walk a day. All right, so you want to be able to do that. It really helps a lot. It's much better. I've done this with my clients, the ones who have done it, like short 10-minute walks, just 10 minutes. Just walk for 10 minutes after you eat, and it's amazing, because if you're on insulin, if you're trying to manage it and you're trying to reduce your insulin load, that walking after you eat really helps considerably. All right, now it's time for the rest of the story. So coming back to Angela, I said, all right, now Angela, I taught her all of this, and I said, I want you to read this book. All right, this is Dr. Neil Barnard's Program for Reversing Diabetes. This is a remarkable book. I said, I want you to read it cover to cover. You read it right away. I want you to get started on this. We're going to get set up. Now, she had a doctor's appointment to get her blood drawn. I said, perfect. We're going to monitor your blood sugar 3 times a day, and you're going to follow the plan to the letter. We're going to do this. You're going to be coachable on this. So this is what we're going to do. So she agreed, and we went to work. So she read the book cover to cover in just a couple of days, read it all. And by the way, there's even a chapter for healthcare professionals in the book. So it's remarkable. Dr. Barnard wrote, by the way, he published his research study in the Journal of the American Diabetic Association. Do you think all the doctors read it? No. Okay, then he wrote this book, and it has a chapter for all the doctors. Do you think they read it? No. So the thing is, it's for you to read. So you want to make sure you read this. Now, so Angela went to the doctor, and I had her figures from the 3 previous months. So I had all her information, her data. So she went to the doctor, and she started the program to the letter that day. I think it was September 9th or 10th. So she started it, and we went to work. She followed it to the letter. She was coachable. So for the next 6 months after that, we gathered the data. I thought I would share with you the data of what happened to her blood sugar. So September 10th, she went to the doctor, and her blood sugar, her A1c was at 9.5%. Now, the 3 months prior, her blood sugar was averaging about a little over 200. So she went to the doctor September 10th, and then for the rest of the month of September, her blood sugar came down to 123. In fact, it was remarkable because in 4 days, her blood sugar came down to under 125. And she didn't have to take an insulin injection for the first time in 7 years. And then after 7 days, her blood sugar was down to 99. And after 10 days, it now was down to about 75. So now we had to start peeling out the medication. So it was really remarkable. So for the next several months, her blood sugar's average came down to very much in the normal range, which is really remarkable. Doctors are thrilled when they see this. They're like, wow. So we started progressively taking off the medications one by one. So some of the improvements, just to show you, in this first 6 months, just in the first 6 months, A1c decreased from 9.5 to 6.6%. All right, released over 50 pounds of fat. Vision completely restored. She was able to drive at night again. Peripheral neuropathy almost completely resolved. Blood pressure became normal. Irregular heartbeats were gone, all right, because she was having concurrent heart disease as well. Sleep apnea resolved and able to sleep through the night. Increased energy. How many of you would like to have increased energy? I'm sure you would. Able to swim again without pain. Her cholesterol plummeted all the way down to 126, and it would have been over 250 before. And she got normal hormones for the first time since puberty. Now, I want to share with you, her A1C today is 5.7%. No diabetes, none whatsoever. Okay, so it's absolutely the case. So this is sustainable. So I'm going to recommend that you get these two books. It's been now that book that I had her read has been updated. So Dr. Neil Barnard's program for reversing diabetes, the revised edition. So get that one. And because you got to have tasty food, right? You want to get Dr. Neil Barnard's cookbook for reversing diabetes. It's 150 recipes. That should get you started. Now, I'm going to send you a follow-up email with about another 2,000 recipes. That should be enough to get you started, don't you think? All right, I hope so. All right, so it's really great material. In addition, if you are type 1 or type 1.5 diabetes, this will make a profound difference. It really does. And I want you to get this book. It's called Mastering Diabetes. All right. It's an outstanding book by my good friend, Dr. Cyrus Kambata. He's at Cal Berkeley. He is amazing. He actually got diagnosed with type 1 diabetes in his 20s while he was at Cal Berkeley as a student. All right. He is amazing, brilliant. And so great material, great references. He's got lots of videos as well. Check him out. And the foreword is written by Dr. Neil Barnard, no less. All right. So it's just outstanding material. So today I've given you lots to get you started. And I hope you're willing to get started. All right. Number one, plant-based nutrition, whole food, plant-based. All right, whole foods, not processed foods, plant-based, no animal-based diet in your diet. Get to being oil-free and decrease your fats to less than 20 grams of fat per day. Eliminate animal foods. Eliminate processed foods. Eliminate alcohol. Make sure that you walk after your meals just for 10 minutes. And then the other thing I didn't talk about, which is really critically important, and I talk about it in many of my other webinars, and that is to hydrate. Hydration is critically important. Drink lots of water, 2 glasses of water first thing in the morning. Drink plenty of water throughout the day. That's one of the things that you want to do as well. All right. So my question for you now is this. Oh, by the way, to get started, pick which one of these areas is the most important for you that would make the biggest difference. Don't go to the easiest. Don't go to the easiest. All right, that's a mistake. All right, you got big things in the closet, take the big thing out first. Don't take out the little things. All right, take the big thing out first. So really make sure you address the biggest rocks first. So take the big one on, make the change there, and then gradually start to increase the other areas. So you want to do it that way. My question is this: would you like to make the rest of your life the best of your life? I certainly hope so. And if you do, what would that look like for you? If you can imagine, what would that look like? If you had your diabetes completely gone, you had energy, you had vitality, you had energy. All right, what would that look like for you? Would you like to be able to live the rest of your life with energy like these people? Would you like to be able to have so much vitality and energy that you could do so many amazing things in your life? So would you like to end up with the last days of your life on the beaches of some beautiful place filled with health and energy, vitality, and having fun? I certainly would like to do that myself. So we want to do that. I want to end up like my godmother, who died at 102, sharp as a tack the entire way, no suffering whatsoever, died in her sleep at 102 with a fulfilled life, full of joy, full of happiness, full of health and vitality. That's how I want to go. So the question is this: where are you now? Are you there yet? Chances are you're not. So how will you get from where you are now to where you want to be? And if you want to do anything where you want to go from where you are to where you want to be, you need a plan, right? So you need a plan, but do you have a plan that's actually proven to work? Chances are you don't, but I do. I have a plan and I'm living proof. So my plan is living proof because I went through it myself and I still continue to use my plan. So I share with you in the beginning how I was 55 pounds heavier and I have pre-diabetes and I have high cholesterol. So when I got shocked by my friend calling me chubby that day, I started to put into effect my 4-point plan. Now, my 4-point plan is no mystery to anybody. I've been an athlete. I was a collegiate swimmer and I played basketball at the semi-pro level. So the thing is, I knew about how to apply the mentality of discipline to become successful as an athlete. So my 4-point plan works in sports, it works in business, it works, guess what, in health. It's no mystery to anybody. So the first part of the plan is that you got to begin from within. You must start here. We must begin from within. Here's the problem. As Einstein said, the significant problems we face cannot be solved at the same level of thinking we were at when we created them. We didn't create our problems intentionally. We created our problems subconsciously. And so what we have to be able to do, which is such an important piece, is we've got to be able to rewire our subconscious mind first. And I've learned from so many brilliant teachers that I've actually got to a place where I actually teach people how to do that. The second step is that we need a proven strategy, because doing the same things over and over again, expecting different results, is insanity. So we need an evidence-based approach, and that's what I offer you. The third step is that we need to be intelligent in setting ourselves up with support and accountability. Nobody, and I mean nobody, is successful by themselves. So we have to be intelligent in how we do that. And then fourth, we need to create a track record of consistency in order to develop habits, because habits produce results. So this is my 4-point plan. I followed it. I still follow it to this day. This is what I teach my corporate clients. This is what I teach my healthy lifestyle clients, and it works. I have several services that I have to offer. I'm going to send you an email. Feel free to check them out. I do one-on-one consultations and one-on-one coaching. A consultation is just where I set you up with a plan, and it's really powerful to be able to do that. I also do one-on-one coaching, and I can do it for 6 months, a year, or even longer. I have some clients that I've been working with for years and years and years, and it's been awesome. All right. I also have a group program. So I have a group program, and it's virtual now, but one day we'll come back to being live. All right. So we're doing it virtual. The next one is going to be over the course of 2 weekends in February, and then I'll do another one in June. But the thing is, it's virtual. So it's really a great program. I did the last program in this past October, and it's virtual. We're finishing up right now with the 12 weeks, and it's fantastic. People are making remarkable breakthroughs in their health, and it's just fantastic. So I've got a lot of things that I cover in my curriculum, many things that I cover. The first weekend is all in the inner game, because we've got to be successful there. Otherwise, we will fail. And then the second is where we load you up with all the information around nutrition, hydration, cardiovascular exercise, strength, and sleep. But then I set you up for success. And so I set you up with that, with specific goal setting, and you'll create the habits that will really empower you to change your life. And then here's just one of my graduates. This is Donna. She's a retired nurse at Kaiser. And in 2018, she was already 8 years of being on a plant-based diet, but she was struggling with some of her health issues. And so she was in my program. She said, Ruben, I got to be able to decrease this blood pressure and lose the weight and be able to get healthier. And so being in the program and being coachable, I was able to help her to fine-tune her program. And one of the things that she did was that she was able to decrease her fats down to less than 20 grams a day. Really remarkable, because when she realized that she was having healthy fats, but too many of them, it made a difference. And over a longer period of time, she was able to lose over 70 pounds. And today she's physically active. And she posts how she's walking. She's walking every day, like 6, 7, 8 miles. And it's really extraordinary. So she is amazing. And she will be the first one to tell you she is living her best life today. And it's really great to see. In addition, I also do programs in the workplace for employers and employer groups. And so I do lifestyle medicine in the workplace. I'm actually on the committee for the American College of Lifestyle Medicine on lifestyle medicine in the workplace. So it's outstanding. This is an incredible program to improve not only the health of the entire workforce, but the productivity and the profitability of the company. So it's a win-win all the way around. So information about me, I'll send it to you in an email. You're going to get all that. So I'm going to stop sharing from this PowerPoint and I'll answer your questions now. Any questions that anybody has, anything at all, unmute yourself because I don't have, let's see. Okay, yeah. Let's see, question, what should someone eat or not eat to decrease high triglyceride levels? Okay, great question, George. So the thing about triglycerides, usually the case is that when triglycerides are high, that's an indication of too many processed foods. That's usually the case. So what we want to do is look at the diet to see what's happening there. That's usually the first place I will look is at the processed foods. And so we want to stay with the whole food, plant-based diet. That's what we want to be able to do. And sometimes people are just, I see this, by the way, with the unhealthy vegans. All right. So what they're doing is they're eating vegan food, but it's processed food. All right. And it's loaded with oils and it's loaded with additives and loaded with all kinds of other things. So then the triglycerides go up with that diet. So it's not a healthy diet. It can be a vegan diet. You can have a vegan diet that's still not healthy. So it's possible for that to occur. Okay, unmute yourself, ask questions. The floor is yours. Go ahead, be brave, ask. I promise I don't bite because I don't eat animals at all, so.
My problem is in sticking with the plant-based diet. I mean, I do eat plant-based,
Okay.
but I eat junk food plant-based.
Got
which
it.
means that I cook with oil.
Yeah, so consider that it's a plant-based diet, but it's not a whole food plant-based diet. So what we want to do is really work on getting it to be a whole food plant-based diet. So no processed foods. Oils are processed foods. So here's what I suggest. You look at being able to really try to cut out the oils. Like,
that's the difficult part.
Well, I'm going to send you in the email, Teresa. I'm going to send you how to cook without oil, how to fry without oil, how to saute without oil, how to bake without oil. I'm going to send you all the resources on that. Okay. You can do it. Okay. You can do it. Okay. It's possible. I mean, you can saute, for instance, just to give you an example, you can saute vegetables with no oil whatsoever. All you need to do, the old trick before there was oils, all right? Here's how poor people sauteed vegetables. They start with the onions.
Yeah.
You start with the onions. You sweat the onions and you add water with the vegetables and you just saute it. I do it all the time. It's really great. It's delicious. It's just wonderful to do that. But you don't need the oil. So there's lots of tricks. Plenty capable of doing that. You're plenty capable. And then here's what I consider, either a consultation, but consider being in the group program. Really consider doing that because you get support in being able to do that. I mean, I've got somebody who was a collegiate athlete. He was a volleyball player in college. He's in the program. And this is what he's been taking on, exactly what you're talking about. He was a junk food, vegan, plant-based, and for years. And so being in the support group, he's really he is 99% whole food plant-based now after 9 weeks. And it's remarkable. I mean, he's just made huge progress. He's lost 15 pounds. He was already in pretty decent shape, but he's lost 15 pounds, feels like amazing. He's climbing mountains and hiking with his girlfriend. And I mean, they're doing incredible things. So
I'm gonna say one more thing, because that part is like, I got my A1c down to 5.4, and that was purely plant-based, and it was purely a raw vegan. Right. And then you have your social groups.
Yeah.
And then you have social groups that are vegan groups, but we eat at the restaurants. Right. And they're supposed to be plant-based and oil-free and all of that. Then it gets you back into the cravings of all the other stuff, and then you're right back where you were.
Completely understand that. Completely. So here's the thing. And you have to be taking, and this is what I learned, all right? I learned that I had to take complete responsibility for my health, that I could not put the responsibility of my health in the hands of the restaurant owners, the vegan society, whatever group, okay? I could not put the responsibility of my health in their hands. I couldn't trust them to do that, all right? So I had to take complete responsibility. Now, that's not an easy thing. So today it is possible, however. I mean, when I started this 25 years ago, totally different. There was no restaurants that had any options. I had to create this. Now today you can actually go to a restaurant, and you can, at Faux Fresh in Rancho Cordova, they have an oil-free menu. And it's a completely vegan, oil-free menu. So it's completely plant-based. It's fabulous. All right. So when my boys come over to have dinner with me, it is only from that menu. That's it. Or I make it. Okay, either one. So the thing is, you have options today. Zest Kitchen up in Rockland has an oil-free menu now. All right. Faux Vegan in Rockland has a oil-free menu now. All right. So there's so many different options that are starting to emerge. I'm getting around to all the restaurants. I'm trying to get to them and say, look, I need you to produce an oil-free menu for us because we need good, healthy food for us. So I'm insisting that they create an oil-free menu. And then as soon as they do, then I make sure everybody knows about it. And that's where I do my seminars, by the way. I do my seminars where they have the oil-free menus. So that's where I do them. But yeah, you pose a very powerful concern for a lot of people, and that is being able to really look out and be distinguishing what's healthy and what's not. And I'm also going to send you in the email some information from Dr. Dean Ornish and his wife on how to eat healthy when you're going out to restaurants, because you can't leave it up to other people. Great, thank you. Who else? Other questions? Let's see. Oh, let me go back to the chat window. Okay, so all right, let's see. Okay, question from Michelle. How to control urges to eat crap? Sorry, how do we control those urges? Oh, yeah. Okay, so when we have those urges, yes, we are in the sympathetic state. So what we have to do is we have to really look at ourselves. This is part of the mind game that we have to really win. We have to win the mind game. So part of the issue is that we've put ourselves in the sympathetic state for a variety of possible reasons. So one of the quickest ways that we go into the sympathetic state is we don't eat for a long period of time. So we end up going into the sympathetic state because we get more than enough hungry. So we should be eating about every 2.5 to every 3.5 hours. So we should be eating fairly frequently. So the consistency of how we eat will help us to reduce those cravings for the crappy stuff that's out there. So that's one factor. Another factor is making sure that you hydrate. So you got to drink your water, because people who don't hydrate, guess what? Puts you in the sympathetic. You start looking for fat, salt, and sugar. I mean, that's what our brain starts looking for. So it's really important for us to be able to hydrate our brain, eat consistently. And then you want to make sure you eliminate all the crummy stuff that's in your house. All right. So don't let yourself have those, sweets and candies and all those other things around there. You want to just get that out of the household. Really important. I had a client who worked with me, and this was a problem because her husband always sabotaged her. Her husband was always bringing home the sweets and the candies and the cakes and those kinds of things. And I said, you tell your husband to talk to me and we're going to straighten him out. And we did. And he said, oh, okay, I get it now. And so he was trying to be a sweet man. And he's such a sweet man. But he didn't realize he was sabotaging his wife's health. So there's lots to this, even more. All right, so let me go back to the next question. Let's see. Consuming sugar-sweetened beverages has been closely linked to elevated triglycerides. So that's another area to look at if you are consuming sugar-sweetened beverages. Absolutely, yes. Oh, yeah. And that's also associated with diabetes as well. We have such an increase of sugar-sweetened beverages and the sodas. Water is always the beverage of choice. Absolutely true. Absolutely. Okay, let's see. Ernie to everyone. I wonder if Burger Patch has oil-free options. From what I have seen, they don't. I don't know if they do. You'll have to ask. The last I was there shortly after they opened up, and they did not have oil-free menu items. Check with them. I don't know. I haven't been there for quite some time, but always ask. Always ask. I mean, that's a good thing to check. So because I mean, I know they're very popular. And people love their food. It's really tasty, but there's a lot of oil in there. And then, okay, any other questions? Questions from anybody? Yes, you're welcome, Lauren. Well, thanks. Okay, thanks.
I'm curious.
Yeah.
What was that one medical question, that one nutrition question when you were in medical school?
Oh my God.
That you referenced earlier?
It was, which of the following foods is a good source of vitamin D? Mushrooms, carrots.
They wanted to hear milk, huh?
and then it was milk. The answer was milk.
Of course it was.
Yeah, it was just like, that was it. I was just like, are you kidding me? So it was crazy. Yeah. Anyway,
that was a burning question.
Yeah, that's great. Any other questions? Other questions? Anything at all? Anything at all? Teresa, thank you for your questions or anything. You, Pat, anybody, George, anyone else? Let's see. All right, thank you. You're welcome. You're welcome. All right, so I'm going to say, so I'll just close up here right now. So I'm going to send you an email. Look for that either tonight or tomorrow, and it's going to have the link to all the slides. So you're going to get all the slides from today's presentation. You're going to get the link to the YouTube recording of this webinar. You're going to get all kinds of resource information related to diabetes. I'm going to send you Dr. Neil Barnard's research. I'm going to send you other things, lots of videos to watch. I used to be a university professor, so I love giving homework, okay? So I'm going to send you all that information about my services as well. If you're interested, check them out. Put yourself in the program. It's wonderful. It's all, you know, it's all a committed effort for anybody to be in that program. So let me know if I can help you. If you have any questions, feel free to text me, to email me, to call me at any time. Just do that and reach out to me. It's my honor and my privilege to share with you. My request now is this. I have one really burning request, and that is this. Please share this with people. Please share this information, because there are people that you know, undoubtedly, of people that you will come across undoubtedly, who have issues with their health and need help, and they need to have some resource to really turn them in the right direction. So please, please, please help me out, because I'm trying to change the world. All right, all of us in lifestyle medicine are trying to change the world. So please help me in getting this word out and share that with you. Raise your hand if you're willing to share this information with others in your life. Thank you, thank you, thank you. All right, thank you for being here. It is my pleasure and my honor to be with you and spend this time with you. Thank you so much. And see you next week will be for Alzheimer's. Alzheimer's is powerful, powerful information. All right, so check that out. Okay, bye y'all.
Thank you.
Bye-bye.
Thank you very much.
Bye.
Bye.